One of the things that I found effective in the clinic, as I've mentioned in other parts of the videos, is just keeping your exercises as functionally applicable as possible. You're going to have your hardcore exercise patients that will want a ton of different exercises. Some of your patients don't even have time for exercising. So if you can make it as simple and concise as possible, that's important. Squats are 90% of the time not done correctly. And one way that people often compensate when they're squatting is when they squat, their knees routinely go over their toes, big time. No quad use, no glute use at all. So if anything you're doing with the patient, if you can correct that, that will make a huge difference. We're made to squat down low. And I think in sitting in chairs, we tend to get this compensation and the glutes shutting down when we're sitting on our largest muscle group. So just working with the patient and having them generally bring in their core, making sure they're not locking through extension, and having them go through a squat. And basically, you want them to keep their weight even through their feet and then sit back. You can challenge them, and then you can test them. So when they're in this position, you can push them a little bit and say, because if they're leaning too far back, they'll fall back if you push them that way. And I didn't push him that hard. You just want to check to make sure, is their core coming in? Maybe he's a little too arched there, so you can have him make that compensation and say, okay, how's his center of gravity this way? So it's a good way to test your patients, and you can do this for somebody any age. I'm not having him go down and do a full squat. And then as he gets good, you can build speed on it. So then he can do a squat and quicker. And you'll see he tends to lordoze, so we need to, there we go, and then come back up again. And go ahead and squat again. And then come back up again. So we can, and go ahead again. And so we can have him build in speed and make sure that he's balanced. To build in strength, you can just introduce a kettlebell once they get good, and then you can have him do some shoulder flexion with the kettlebell, and again, come back down and go one more time. And then you can check his balance to make sure that he's balanced, knees are lined up, and they have good form. Just this one exercise, not even with the kettlebell, but showing people how to sit and stand correctly can take a lot of stress off the low back and a lot of stress off the knees as well.